Hi, it's Dr. Noel Williams, Oklahoma City, Oklahoma, Optimal Health Associates, May 11, 2020, COVID update. Numbers, steady trend, 4.2 cases in the world, 285,000 deaths, about 1.385 million in the United States, 80,500 deaths. Oklahoma, about 4,600 cases, 272 deaths. So numbers just slowly progressing. The U.S. numbers, a little flatter again, still 17,000 new cases today, or yesterday, same amount the day before, about 870 to 80 deaths. So, or 870 to 80 deaths. So a little bit more than the day before, but at least not shooting up into the thousands, or 2,000 or 3,000 like a few days ago. So we're just going to have to wait and watch and see what happens. Let's talk about a few things though. First, let's talk about Kawasaki syndrome. It's a autoimmune syndrome that occurs after viruses. When people my age were young and got chickenpox when we were 2 or 3, we could have gotten this syndrome. You can get it after a cold, a flu, hand, foot, and mouth. And it looks like COVID, which is just, again, a viral infection. And we all know that there's some abnormalities with autoimmune response with this. It looks like some little kids are actually getting Kawasaki syndrome after potentially an infection with COVID that may have not been noticed because they're pretty asymptomatic with COVID itself. So what happens with this is you get your body attacks your body, so kids get a fever and they get a peeling rash. Classically, it's more 2 to 3. This is running a little older, sometimes through, I guess, the oldest may have been 7 to 10 in New York. And so fever, rash, but then that in and of itself is self-limiting. Supportive care, usually a little bit of intervention. They can have abdominal pain, but then a small group can get vascular disease or vascular events where they can get coronary artery inflammation or aneurysm. So in New York, it looks like there's been 64 roughly Kawasaki cases, perhaps associated with COVID since this all began, keeping in mind that there's 20,000 Kawasaki cases a year annually in the United States. And if you figure, there's 7 million people in New York City, roughly, that's about, 2% of the population, 2% of 20,000 is 400. During the flu season, you're going to probably have 200 to 300 of those cases from November to April. So it may be the COVID-19 infection that's occasionally occurring, or it could be some others. But Kawasaki syndrome is extraordinarily rare, and I don't think it's something that as parents we need to particularly worry about. It is definitely something that pediatricians need to be aware of, and I think that's why the New York Health Department highlighted it, because it's not something that pediatricians think of just routinely as, oh, Kawasaki disease after a viral infection, because they may see 1 or 2 in their career, maybe. And so it's just not a disease or a syndrome, a series of events after an infection that is common. But I don't want people to feel intimidated about it. I mean, what's our incidence of pediatric infections in Oklahoma? It's virtually nil. I'm talking to someone from Children's Hospital today who just works there, that they keep track of all this and talk about it all the time at work. She said as of last week they'd had 1 positive case through the ER. Cameron Mantor, who's chief medical officer, who's been in the inter-hospital group several weeks ago, 3 or 4, they'd had none. So, I mean, they just are not seeing cases. And so whether they've seen 1, 2, or 3, they're just not seeing cases even though they're testing. So kids are just not getting symptomatic or getting it that often. So I don't want anyone to feel overwhelmed that this is a huge crisis and they really need to be concerned, or that it should really impact decision making on normalization in terms of kids. Kids are different. They are not getting sick that often unless they get immersion, subversion, meaning they just get locked in an apartment with a sick adult in Wuhan or New York, and then that sick adult managed to get everybody else sick. Community-acquired kids' infections are very, very, very rare, and the kids just do not get sick that often. It's very, very rare. So I think normalization of starting some, for example, T-ball practices and some of that stuff makes a lot of sense. I think, again, the kids should be on a Flintstone with the little zinc if they're smaller kids, and a little bit more if they're, in teens. But ultimately, hand sanitizer for the kids, hand sanitizers for the coaches, some masks perhaps for the adults, especially if they're older. But if they're younger and healthy, and I think it's okay to be outside and have some normalization. Okay. Now, if one of the coaches is a healthcare worker at Integris in the ICU where there's COVID patients, no, that's not for you. You're not included in that. If you're a healthcare worker dealing with COVID patients, you have to skip all of those activities right now. I think you just have to be very prudent because you could always be a carrier without knowing it for 3 or 4 days or 5. So again, I think those people have to make a lot of sacrifices. So again, Kawasaki disease, not super important in terms of overall risk to children because the incidence is so low. In terms of death rates, let's talk about death rates. I had put in I'd said in one of my earlier podcasts, if that's what I call this, the overall death rate I thought for COVID would end up being about 1%, and I needed to specify of documented infected patients. The current rate is 6%, and when you look at all the different numbers and what people say, who think about it, they think the final death rate for documented infected patient or documented infected people is going to be about 0.5% to 1%. Because what's going to happen, even though it's 6% now, is there's going to be more and more and more and more testing of symptomatic patients. So we will get a much larger number of positives, which is going to bring that 6 down to 1. But what's going to be the real death rate? And that's the big question, because the whole issue with death rate stuff, which we've gotten obsessed with a little bit because of all the politics, is going to be lower. And the thing you have to realize, if you're one of the people who die or you're in those families, it really does matter to them. And so this statistical stuff isn't very meaningful to you. The second thing to realize before I answer what I think the final death rate will be is, how do they calculate the flu death rate? It is not, when you're hearing, 17,000 people die a year of the flu, are there 17,000 documented deaths? No, it doesn't work like that at all. What happens is they take the number of documented flu deaths, which is really 3,000 or so, excluding a couple years ago when it was 16 or something. They then put it through a formula at the CDC, my favorite organization besides the NIH and the FDA, and they spit out a number, and that's where the 15,000 to 16,000 cases come from every year. But it's usually just 3,000 documented cases. And so the year that they said there was 60,000, there was actually about 16,000. So this documentation of cases and the final numbers way different. And if you look at hospital administrators and chief medical officers and physicians I know in this interhospital group, none of them have ever felt any pressure to call a COVID patient or call a patient who's sick or dying or died a COVID patient. That isn't how doctors are trained. I'm sure there's exceptions, but at least in Oklahoma, neither the administrators nor the physicians that I know who are involved with this have had any pressure at all to call someone a COVID patient. Our big issue has been we haven't had enough tests, so there have been people who died in March who were COVID patients, but we couldn't document it. And that's where we're coming from, a more sensitized area. But keep in mind, we ranked about 49th for testing in the United States. So that's why we've been rather sensitized to this whole thing with testing. And that reflects some of my views on it too. And the numbers is we didn't have testing. So that affects our judgment on it. But physicians don't feel pressure, at least here, to call a patient a COVID patient, at least that I've heard of from anyone. Plus, physicians here and the physicians I know and people like me, if an administrator said, you need to call any of these COVID patients, it would make me rather angry. And I would have a reaction to it, which would be probably not pleasant. So, and that's how most of the doctors I know are. I mean, doctors are crazy. I want to be clear about that. But one of the things that makes them get angry is an administrator telling them what to do. And most good administrators know that too. They have to be led gently, but not to do unethical things like that. So enough of that subject. So what would probably be the true death rate? So or not influenza, but Spanish flu, the actual death rate was 600 per 100,000 patients. Okay. or per 100,000 in the population. The true death rate for COVID is probably going to be somewhere in the range of 100 is what I think people are estimating. So if you look at infected portions, so it's going to be much less than Spanish flu because we have better medical care, and so it's very helpful. What's the actual death from flu on average? Influenza, it's about 5 to 7 per 100,000. So that's probably what we're going to end up in at a population base. It's probably going to be about 100 per 100,000, or about 1 in 1,000 people in the country. But again, those are just guesses, and they're not definitive. And I'm doing what I can to provide data as I'm seeing it and reading it, and that's all we can ever do. And keep in mind, that's how these things work when you're doing a podcast. You're trying to give information that's accurate and helpful. And along that same vein, what do we need to be thinking about? We're thinking about normalization. I want people to think about normalization. I want you to be able to see your grandkids. So if you're a grandparent and you want to see your grandkids, I think that's reasonable. You just need to wear a mask. You need to be on your vitamins. You need to be using your hand sanitizer, and your family needs to use their hand sanitizer, and you can get a hug and say hi. If you're under 65 and you're pretty darn healthy, I don't really think you need a mask anymore, at least from the kids. Now, the other adults you may be around, yes, especially in public places. But when you're with your family and they're all low-risk people, meaning they're not in healthcare, they're not being exposed to COVID, and they're washing their hands, and they're wearing masks when they're in public places, you're in pretty good shape. I think that is okay. Am I encouraging you to go, if let's say the OU football game was next week, would I encourage you to do that? No, I wouldn't encourage you to do that yet. That's why we have a new president of OU. He can make that big decision for how they're gonna handle that in the fall. But right now would not be the time to go to an OU football game, because you got to get in and you got to get out, and getting in and getting out is where all the contamination is going to be, or the majority of it, besides the bathroom. So that's the big problem with sporting events moving forward, and concerts, and anything that there's a large group of people coming in or going out. It's the contamination from just those rare people who are carrying the virus. Because again, it doesn't take that many people with the virus asymptomatically to potentially expose thousands and thousands and thousands of people in an arena or in an event center. So that's where it gets tricky. But if you're just at home with family, you're going to probably be fine, as long as everyone's low risk. But there's always risks. You have to understand that. But I think part of it is balancing all of that. I would still encourage everyone to wear a mask in public. If you go to a grocery store, you go anywhere, wear a mask. The White House is going to come out with that. They're excluding Trump from that recommendation. But there's several jokes. But anyway, masks are important. Okay, they spread or stop the spread of droplets massively. Now, if you cough into a mask, you're still going to have some leakage laterally, but you're going to stop the bigger portion coming out. And you're going to have some mild to perhaps even moderate, depending on what kind of mask you have, protection also. And again, hand sanitizer, and then multivitamin, zinc, etc. And anyone who's having a lot of problems with zinc, if it's making you nauseated, Flintstones. All of us can take Flintstones, even adults. So just take a Flintstone with a 10 milligram zinc in it. It's going to be tolerable, because it was tolerable when we were kids. I've put a fair number of adults on it now because, hey, everyone can take a Flintstone without getting upset stomach. So, not everyone, 99% of people. I'm sure there's someone who can. So I hope all this makes sense. Have a pleasant evening and a great week, and I'll update you later again.